1. The nurse is caring for a primigravida who gave birth yesterday and has chosen to breastfeed her neonate, which assessment finding is considered unusual. A. Milk production. B. Constipation. C. Diaphoresis. D. Diuresis. Two. The nurse is caring for several mother-baby couplets. In planning the care for each of the couplets, which mother would the nurse expect to have the most severe after pains? A. G4P1 client who is breastfeeding her infant. B. G3P3 client who is breastfeeding her infant. C. G2P2 cesarean who is bottle feeding her infant. D. G3P3 client who is bottle feeding her infant. Three. A breastfeeding client is seen at home by the visiting nurse 10 days after a vaginal birth. The client has a warm, red, painful breast, a temperature of 100 degree F, 37.7 degrees Celsius and flu-like symptoms. What should the nurse do? A. Encourage the client to breastfeed her infant using the unaffected breast. B. Refer the woman to a primary health care provider. C. Inform the client that she needs to discontinue breastfeeding. D. Instruct the woman to apply warm compresses to the affected breast. The correct answer is B. The client is presenting with signs of breast infection, mastitis. So refer to her healthcare provider to prescribe some antibiotics. She should continue to feed on both breasts. 4. A diabetic postpartum client plans to breastfeed. The nurse determines that the client's understanding of breastfeeding instructions is sufficient when she states A. Insulin will be transferred to the baby through breast milk. B. Breast milk from diabetic mothers contains few antibodies. C. Breastfeeding is not recommended for diabetic mothers. D. Breastfeeding will assist in lowering maternal blood glucose. The correct answer is D. Breastfeeding consumes maternal calories and requires energy that increases the maternal basal metabolic rate and assists in lowering the maternal blood glucose level. Insulin is not transferred through breastfeeding. 5. A 1-day-old breastfeeding infant has a bilirubin level that is at an intermediate risk for jaundice, which statement by the infant's mother indicates an understanding of the teaching regarding jaundice. A. I should breastfeed my baby as often as possible. B. I should supplement with formula after every feeding. C. I should discontinue breastfeeding and change to formula feeding. D. I should place my baby in direct sunlight several times a day. Six. During a home visit, breastfeeding. Client asks the nurse what contraception method she and her husband should use until she has her 6 weeks postpartum examination. Which of the following will be most appropriate? A. Oral contraceptives. B. Condom with spermicide. C. Rhythm method. D. Abstinence. Seven. A primiparous woman who is beginning to breastfeed her neonate asks the nurse, is it important for my baby to have colostrum? The nurse should explain that colostrum provides the baby with A. more fat than breast milk. B. Delayed meconium passage. C. Vitamin K which the baby lacks. D. Passive immunity. The correct answer is D. Colostrum is a thin, watery, yellow fluid composed of protein, sugar, fat, water, minerals, vitamins and maternal antibodies, for example, immunofluorescence A, which are all necessary for passive immunity. 8. Which of the following forms the basis of the teaching plan about avoiding medication use unless prescribed for a primiparous client who is breastfeeding? A. Breast milk quality and richness are decreased. B. Medication may be excreted in breast milk to the breastfeeding neonate. C. The mother's motivation to breastfeed is diminished. D. Medications interfere with the mother's leg down reflex. The correct answer is B. Some medications can pass through breast milk and affect the neonate. The client should avoid all non-prescribed medications. (9) A breastfeeding primiparous with a midline episiotomy is prescribed. Ibuprofen 200 mg orally. The nurse instructs the client to take the medication A immediately after a feeding. B before going to bed. C midway between feeding. D when providing supplemental feeding. (10) A multiparous client, 28 hours after cesarean birth, who is breastfeeding, has severe cramps or after pains. The nurse explains that these are caused by which of the following? A. Healing of the abdominal incision after cesarean birth. B. Flatulence accumulation after a cesarean birth. C. Release of oxytocin during the breastfeeding session. D. Adverse effect of the medication administered after birth.